Part 2, What to Expect in the Hospital to Home. The remaining slides will address nursing care, PT, care management while you're in the hospital, and PT at home. Following your surgery, you'll awake in your own hospital bed. After a short stay in the recovery room, you'll be brought to your private orthopedic room. Your blood pressure, pulse, and oxygen will be monitored. Once stable, this will occur about once per shift. You may have oxygen given to you in your nose by a nasal cannula. This will be discontinued soon. Your total joint care team will continuously monitor and treat any discomfort. Ice or gel packs are the single most important thing you can do for your discomfort and swelling. This should be in place most times in the hospital, except for when you're walking. Never walk with the ice or gel packs in place. They can slide down and be a tripping and fall hazard. A pain scale will be used to assess discomfort. Understanding that obtaining a discomfort level of 0 is unlikely following any surgery. What is your comfort goal? Share this goal with your team. We can help get you there. Your intravenous fluids may continue for some time to ensure adequate hydration, and even if your fluids are stopped. Your IV will remain in until you're ready to transition to home so that we can administer some required medications. Nausea is less common due to many medications now available. If you're feeling queasy, let your nurse know right away. Your surgeon has ordered medication for you that can be administered quickly and provide you with relief. Again, if you know you're prone to post-op nausea or vomiting, let your surgeon and pre-admission center know before your surgery. You must do some lung or breathing exercises to help prevent pneumonia. You'll be given an incentive spirometer in the hospital and be instructed on how to use it. You'll continue this for at least 2 weeks following your surgery. Once it's determined safe by your total joint care team, you'll be out of bed walking with the assist of 2 staff members. It may be physical therapy or nurses that help you walk. In the hospital, when you're not walking, you'll be wearing sequential compression sleeves on your lower legs to help prevent blood clots. They'll gently squeeze your lower legs to help prevent the blood from pooling in your calves when in bed. You'll also be wearing compression stockings. Total hip patients will have knee highs. Total knee patients will at first have a thigh-high stocking on the unaffected leg. The operative leg will have a large ACE bandage wrapped from the toes to the thigh. Before you go home, the ACE wrap will be removed and the other stocking will be applied. The stockings are to be worn for the first 4 weeks following your surgery. You may remove them at night for sleep if you wish, and up to 1 hour during the day for skin care. Advance your diet slowly to avoid nausea. Start with clear liquids. You'll eat your meals sitting up in a bedside chair. Constipation can be a problem following surgery, so continue to use your stool softener that your surgeon started you on pre-op. You may stop the iron and folic acid following your surgery. Your surgeon will order a blood thinner to prevent blood clots for after your surgery based on your individual health history. Most often, these are taken by mouth and started the day after surgery. Some blood thinner prescriptions require pre-authorization from your insurance company. Therefore, a prescription from your surgeon may be given to you to fill before your surgery to have on hand for when you return home. It is extremely important that you do not begin any blood thinner before surgery. This would result in your surgery being canceled. Your Aquacel dressing will be applied under sterile conditions in the operating room and will remain intact up to 7 days. The Aquacel dressing is also water resistant. You may shower as long as the dressing is intact and you cover it with some cling wrap or plastic wrap. You may not take a bath, swim, or get in a hot tub. Only a quick shower is permitted. Before your transition home, you'll be provided with 2 Metapore dressing changes to take home as well as written instructions. As long as your Aquacel dressing remains intact and free of excessive drainage, it may stay on for a full 7 days. You will be given verbal and written instructions of when it may be necessary to change it sooner. Once the Aquacel dressing is removed, the Metapore is applied. You may not shower until your staples are removed. Your total joint team will provide you with verbal and written instructions before your transition to home. This is a list of items you may and may not bring with you to the hospital. Do bring your total joint guidebook, your ID, insurance cards, advance directives. You may bring cell phones, tablets, and chargers. Bring your own loose, comfortable clothes and closed-toe back shoes. Bring your CPAP if you use one for sleep apnea. Do not bring valuables, credit cards or money, no jewelry. Do not bring any medications with you to the hospital the day of surgery. We have a fully stocked pharmacy. A physical therapist will work with you up to 2 times a day on your exercises, bed mobility, transfers, ambulation, and stair climbing. An occupational therapist may work with you on activities of daily living, such as bathing, dressing, toileting, home management, and using adaptive equipment for these activities. A physical therapy assistant will often assist you for added safety measures. A physical therapist or nurse will assist you in getting out of bed to walk and sit in a chair the same day of your surgery once you arrive to the orthopedic floor. For your safety, never get out of bed alone. Always call for the assistance of your total joint care team. You will be allowed to place full weight or as much weight as you can tolerate on your operated leg. Exceptions to this will be discussed with you by your surgeon and physical therapist. You will be instructed and practice how to safely navigate the stairs before you transition to home. Always use a railing. 2 are ideal, 1 on each side. If there is only 1 railing, you will also need to use a cane or crutch in the hand without a railing. It is more common to use a cane. The technique is to lead up with the non-operated leg and lead down with the operative leg. Total knee replacement patients have this precaution. You must keep the knee fully extended straight when in bed. Never place a pillow or anything behind the knee. This will cause your knee to remain contracted in this position and therefore making it very difficult to walk, requiring more therapy and causing you more discomfort. A rolled towel under the heel while resting in bed or sitting in the chair with your foot elevated will help to keep your leg extended. For total hip replacement patients to help prevent your hip from dislocating, you must follow these hip precautions for at least 6 to 8 weeks. No bending more than 90 degrees at the waist, no crossing your legs, or no pivoting or twisting on the operated leg inward. Your therapist will help you to understand these precautions before you leave the hospital. Your therapists and nurses will review and assist you in safely getting in and out of your car when you leave the hospital. Start by practicing at home. Move the passenger seat as far back as it will go and recline it approximately 45 degrees. Turn to sit on the car seat first. Use your arm to steady yourself on the car frame. Lean back while pivoting your legs to bring each one into the car. You do not need to bring your walker to the hospital, but please have your walker in the car of the person driving you home from the hospital for your safe transfer out of the car. If your walker is new and needs to be adjusted for your height, have your family or friend bring it in the morning you're going home, and physical therapy will adjust it for you. Your case manager or care coordinator is a registered nurse or a licensed social worker that will assist with setting up your in-home therapy before you transition home. Our program is affiliated with Hartford Healthcare at Home, but you may choose any agency you wish. Regardless of what agency you wish to use, you will receive a phone call from the pre-admissions department at Hartford Healthcare at Home within 14 days before surgery. You will learn how home care will assist you with your recovery at home. They'll establish your preference for a home care agency, discuss insurance benefits, what to expect from home care after surgery, and to discover how to best plan for your recovery in your home. Everything discussed about your home in this conversation will be shared with your surgical team at Windham Hospital in order to optimize the care you receive while you recover in the hospital and to provide a smooth transition home. It is recommended that you obtain any assistive devices before surgery, for example, your walker and cane. If you can borrow a walker from someone, do so. A walker is required for your safety by your surgeon for the first 2 weeks after your surgery. Your insurance carrier may cover all or a portion of the cost of the walker. You will need to contact your insurance carrier to determine this before your surgery. You may need a commode or raised toilet seat if your toilet is low. This is a must for total hips to maintain your hip precautions, but very helpful for total knee patients. Besides being portable, you can remove the bucket and place it directly over your toilet. Its legs can be adjusted for your height and it has handles which are very helpful for sitting down and getting up. A hip kit can be purchased and is helpful for both hips and knees. It includes long-handled reacher, long-handled shoehorn, sponge, elastic shoelaces to replace existing ones, and a sock donning aid. It's helpful to have grab bars installed in the shower for safety. Suction grab bars are not recommended. And have a shower chair available. You will have some dressings given to you at the time you leave the hospital, but you will also need some additional dressing supplies. Your home care will include visits from your physical therapist. Only if medically necessary would a visiting nurse be ordered by your surgeon. The initial visit will involve your therapist reviewing medications, assess your dressing, home safety, home exercises, and they'll answer any questions and concerns you may have. Your therapist can help you to assess your surgical wound and change dressings when it's time to do so. Your physical therapist can contact your surgeon for any concerns they may have, if necessary. It's vital to be fully committed to your home exercise program in order to have the best possible outcome for your new hip or knee. It's always important to balance activity and rest for optimal recovery following surgery. There are a few things to consider about your home environment for your safety and comfort before surgery. Do you have steps to enter your home? Then it's ideal to have 1 or 2 handrails in place for your safety. Stairs will be practiced in the hospital. Remove all throw rugs. They're a major tripping hazard, especially following total joint surgery. Clear pathways in your home. Ensure paths are well lit. Tie up loose cords or anything else you could trip on. Have a sturdy, comfortable chair with arms to sit in and footstool to elevate your operative leg. Set up this area with everything you need during the day: phone, remote, tissues, water bottle, or anything else. A power lift chair is not necessary unless that's what you normally use. If your bedroom is upstairs, you may want to temporarily set up a bedroom or sleeping area on the first floor level for comfort. This is not necessary. In most cases, you'll be able to safely navigate the stairs. However, it's recommended that you limit the trips up and down. For instance, go up at night for bed and down in the morning for the day for the first several days. If you're having a total knee replacement, you'll have in-home physical therapy 3 times a week for 2 weeks. Therapy will emphasize on your home exercises for gaining knee motion and strength while controlling swelling. If you're having a total hip replacement, you'll have physical therapy twice a week for 2 weeks. You must follow your hip precautions for the first 6 to 8 weeks after surgery. Your therapy at home will emphasize gaining strength in your hip and generalized endurance. If you've had total hip replacement surgery, it's important to maintain your precautions. For your safety, ensure that when you sit in any chair, your knee is not higher than your hip. It's a good idea to test all seats and toilets before surgery and make these adjustments ahead of time. If your toilet is low, a commode may be necessary for maintaining your hip precautions. It's always important to balance activity and rest for optimal recovery following surgery. Ice and gel packs are very important after surgery to help minimize swelling and discomfort. After 2 weeks of in-home therapy, you'll transition to the outpatient clinic of your choice in order to achieve optimal results. We have a responsibility as your total joint care team to provide you with the expertise and care so that you can safely return to your life. You, as the patient, have responsibilities as well. Follow all recommendations from your surgeon and your total joint care team of professionals. Participate in your therapy at all stages of your recovery. You must ensure you have someone to stay with you the first 2 to 3 days and that you will have the help you need to recover safely. Be sure you have the equipment necessary for your safe recovery, some of which may not be covered by insurance. You may need to call your insurance company to determine coverage of equipment. You must ensure safety in your home, removing throw rugs, having handrails, bathroom safety. We will set up your home care before you leave the hospital. You must set up and get to outpatient therapy after your 2 weeks of in-home therapy. Your surgeon's office will assist with this by making a referral to the outpatient therapy office of your choice. Physical therapy is the key to optimal results. Not attending or skipping appointments may result in a delay in recovery and affect the overall movement of your joint and your final outcome. Your total joint care team wants you to have the best possible outcome.